When it comes to family incomes and overcoming poverty, Americans are getting mixed signals, and there's reason to fear new policies will mean lost ground in years ahead. That's the subject of a new report from the Mass Budget and Policy Center about obstacles on the road to opportunity. To tell us about the report and what it means for efforts to fight poverty are the center's communications director, Reginauld Williams, and the executive director of the Massachusetts Association for Community Action, or MASCAP, Joe Diamond. Thank you both for being with us.
Thank you.
Thanks for having us.
I want to start with Reggie because at Mass Budget and Policy Center, you've been almost spearheading some gains for some low-income wage earners in Massachusetts, but I guess there's also a lack of progress. So between those two, what do you see?
Yeah, so at Mass Budget, we're really working to co-create policy solutions that work to champion equity for low to moderate income families in Massachusetts. And while we've seen key policy gains in things like, earned sick time, paid family medical leave, the increase in the minimum wage, the minimum wage at $12.75 for a family of four would now net, $26,000 annually? When we're seeing how policies are really a choice and that we have the chance to really help stop inequality from really plaguing our communities in the Commonwealth, we have to see where best we can eliminate poverty. Poverty is often the result of under-resourced communities, and if we want to really create equity in the Commonwealth, we have to be able to really chart that way forward, and that's what the report's about.
Joe, what do you see? Do you see progress, stagnation, or what exactly?
Well, as far as the information that the report provides and the information that Mass Budget always provides, we do see progress, but we also see stagnation. What we see is the report itself is both comforting and alarming. It's comforting because it lets us know that the programs that we've talked about before and programs that we're familiar with, like fuel assistance and food stamps, SNAP, if you will, Medicare, Medicaid, and other programs, do keep hundreds of thousands of people in Massachusetts, 900,000 out of poverty or avoiding poverty, in fact, cutting the poverty rate in half, if you will. But the alarming part of it is that poverty really is the story of low-wage work in large part. And so we find that wages themselves, since about the late 1970s, really have not kept up with productivity. And the wages for middle and low-income folks have remained roughly the same, if not really increased, but high-wage earners have almost quadrupled. So there is this structural challenge that we continue to need to deal with. We need to bolster and strengthen the programs that we work on, that we know are successful. At the same time, we need to work on wages and jobs.
Reggie, there's a lot of places in Boston where you could walk around and think of poverty as being far away, not affecting that many people. But if you just look at families with kids in Boston, it doesn't look that small.
Yeah, it's interesting, Chris. So, in Massachusetts, the median income for a family of four is roughly $105,000. When you look at Boston specifically, it's about half at approximately $52,000. You want to contrast and look at a community like Springfield. The median family income for a family of four is roughly $32,000, which is really close to the federal poverty line of being near poor. That type of tale of two cities and tale of two communities is often felt in Boston when you look at practices like redlining and where access has really been driven to local communities. And I think as we talk about low-wage work and making sure that folks have access to opportunity, like Joe said, we need to make sure that folks are able to really access those opportunities to move forward.
Joe, I guess this starts with kids when they're very young, whether it means early education or sometimes health care that would intervene with problems. I guess there's still a lot of unmet needs there.
Well, it's true, and a lot of the programs that we work with and that we run, we consider, even though they're not labeled as preventative programs, they really are. For example, fuel assistance is one of those. It's considered to be both an economic support program and a health and safety program at the same time. And studies have shown, Boston Medical Center has done studies that have shown that children who grow up in homes where fuel assistance isn't available or where they are cold, they don't develop, they don't grow up healthy. And so that's just one example about how when we have these programs that we can work together with other programs that we can arrange together, we can really strengthen households in a very comprehensive way. The challenges that Reggie spoke about too are important to note. Some of the burdens that people face are really critical. Housing burden, for example, or housing cost burden, for example. About a quarter of all people who live in homes today pay over 50% of their income on rent. Those people who rent, and that's an incredibly high figure. It's even higher in the city of Boston, for example.
Reggie, we've heard a lot lately about people who are plotting cuts in food assistance as they did at the State of the Union address. But I guess also, as your report notes, most of people, at least most of the households getting assistance, is somebody who's working already.
Yeah, so we know that families are working, but it's really a matter about, I think, as I said, making sure that families can make those ends meet. When we see that these choices in Washington are really having an effect on local communities, we have an opportunity to really help make sure that families and communities are engaging in the discourse. You know, that's why we've worked with community action agencies to really talk about these issues, and then just really informing the public on where they can take action to ensure that as they're working to make their work for them, that the policies are also supporting them.
This has been the news. We're talking with Reggie Williams from Mass Budget and Policy Center and Joe Diamond from Mass Camp. Joe, what about immigrants? Because this is one area where if programs have not changed yet, we're hearing a lot about changes to come, and that could affect a lot of people in Boston. What are you worried about?
Programs related to what, Chris?
Let's say services, government programs that immigrants are eligible for, but they might be afraid of using.
Well, that is an absolute reality, and we do our very best to make sure that folks know that they can come into our agencies anytime for assistance. There are some chilling effects related to some of the changes that have come down related to services or what has been referred to as a program that would, if people are accessing services and they're immigrants, then they are concerned that they might be considered a public charge, and that's been a challenge and a problem. But we are doing our very best to make sure that folks that we work with know that they can come to us. Reggie mentioned something about reaching out and working together in communities. The report has been a wonderful platform for us to go out across the state. We've had actually 7 forums on poverty in different communities across the state, in Boston, in Lawrence, in Worcester, in Berkshire County, in Springfield, and other places, in Fall River, to talk to the local community, local advocates, people who live there, about the findings of the report, and then also about what can be done locally to address poverty. We find it's incumbent on us, and again, through the support of Mass Budget, to continue to raise awareness about poverty, because I think people assume because the economy is stable that poverty is going away, but it's not, because of the reasons that we mentioned. So for that and other reasons, we ourselves are working with legislators. We're going to be proposing a commission on poverty and opportunity. There's not been one in Massachusetts, and the goal for that commission, involving all the right stakeholders, would be to develop a set of policies and programs and practice recommendations that would be developed over the course of 6 to 12 months, but that the commission itself would stay in operation for at least 10 years, so that we can continue to monitor and pursue and advocate for these programs that we know work, and we need to continue to advocate for them. For example, the earned income tax credit, every year we do our best to increase that at the state level. We also need to support free tax preparation where we can, and we know that legislators support that. And now we have a proposal before the legislature to increase state resources for fuel assistance. So it's those and other programs that we are doing our very best to deal with. Something that the commission would take a look at is something that we refer to as cliff effects, which is really essentially the sudden cessation of benefits to people as their incomes rise. That is sort of an unintended effect of the programs that have been developed over the years, and so a large number of people are looking at that, and we hope to be able to address that fairly soon. That's a structural challenge as well.
Reggie, you present a lot of proof in this report that there are programs that can relieve hardships at a given point in time. But what about being able to say these programs work and help people move up to something better? What would you point to?
I would definitely point to the sections of the report that talk about where low-wage work is really not compensating enough and helping folks to meet the road in that facet, and then also to looking at those types of policies like Joe mentioned, like the earned income tax credit, the child tax credit, the VITA sites, and other programs that are mentioned in the report that can really help outline where folks can find best practices. Also, too, in terms of the accurate count of folks in these low and hard to count communities, with the chilling effects of things like public charge, as Joe mentioned, making sure that we're getting an accurate and complete count in the 2020 census is crucial to make sure that these under-resourced communities are really heard, and that the support that they can need can come to them in a timely fashion.
And Joe, I guess the reason you're concerned about this is not only because it's a concern everywhere in the country, but I guess here in Massachusetts, we have a hard time getting the full count, it seems.
It's interesting to learn that we do have a hard time getting the full count, and Massachusetts was identified as one of the states where it could be tough, and it has, I think, to do with how diverse we are and actually how knowledgeable folks are in Massachusetts. It's an interesting point to think about Massachusetts too when you think about the rest of the country, not only in that aspect, but we've learned from the report and from other reports that Massachusetts, surprisingly, is in the top 10 of states when it comes to inequality. The gap between rich and poor. And that has a lot to do not just with income, but with cost of living, if you will. And then that has a lot to do itself with the cost of housing. So while in Massachusetts we have an active and strong set of communities across the state, and we've got a really wonderful safety net and one that we can continue to build on, there still is this sort of persistent inequality which we are dedicated to addressing.
Reggie, if people want to see this report in full, I think you've got it on your website at Mass Budget.
Yes, absolutely. Yep, it's on the Kids Count section of our page.
And Joe, you also have a website at MassCap too, right?
Yep, masscap.org.
All right, thank you both very much, Joe Diamond and Reggie Williams.